For many families, sending a child to daycare can cause natural anxiety. Most families have faced similar feelings. In this video, 4 families share their experiences about sending their child to daycare.
We started William in daycare when he was about 1. I didn't have any concerns about placing him in childcare. He had been very healthy. He hadn't been in the hospital. He hadn't been very sick. He hadn't been on a lot of antibiotics. In our area, there are a lot of very small family-oriented childcare facilities. He needed to have enzymes when he ate while he was at childcare, but other than that, they were not responsible for any of his CF care.
Aisha went to a Head Start program when she was 2.5, and they were great with her. Putting her into daycare was a huge decision for me, just for her health. It was the best thing that she could have done for the social aspect and the learning, getting her ready for kindergarten.
Connor just started daycare in the fall. It was important for us that Connor went to a small group environment because I wanted him to have that interaction with other kids his own age. You know, being at home with a sitter all day, I didn't feel like he developed the relationships with his peers that are so important at that age.
My daughter's very social, and she has never met a stranger in her life, and our care team really supported the idea that, you know, she needs to live life and she needs to be a kid, and being around other children is part of that. So we started looking at little half-day preschools where she could get out in the world and be exposed to germs and all of that, but at the same time start, you know, getting socialized. Went with the one that just felt the best. The program was small. They had 2 teachers and 12 kids. She loved it. She has never once been the kid who was crying in the parking lot not wanting to go in. She's ready to go. She loves school.
The biggest concern that I had putting her in daycare was germs.
Germ things were the most important to us, to make sure they had it under control.
Lots and lots of little kid germs.
Of course, hygiene has always been a concern with getting infections and such, but other than that, which I was nervous with, my older child is the one without cystic fibrosis, and I was nervous about her getting sick when she was little, so really it wasn't any different.
We asked a lot of questions about infection control of the school, like what their procedures were.
Went there and checked it out, and so we thought, you know, to make sure we were comfortable with it. And so
and
we
talked
were.
to other parents too that I know that have kids in that school, what their experiences have been.
I knew that I couldn't keep her in a bubble for her whole life, and she needed to go to daycare at some point.
When William started childcare, I did not have any concerns about infection control. Even on the buses, there were the hand sanitizer pumps.
He didn't have any frequent illnesses after starting.
Yeah, he's really been great. He's washing hands. We've been working on washing hands at home.
Yes, every day, every time.
When Bridget first started school, we stumbled a little bit on how to educate the school, and we weren't exactly sure how much to disclose because we wanted her to be treated like every other child, but we also wanted to make sure that, you know, she was getting extra hand sanitizer and hand washing, and, you know, if there were other kids sick, we knew about it. So the first year, we waited a couple weeks so that the teacher would know her before she knew CF. We went in a couple weeks in and we said, hey, here's this issue you should know about. It shouldn't affect her school at all, but here's the things you can do to help us. And, you know, if there's other kids that are kind of, you know, runny nose that day, can you sit her on the other side of the classroom? You know, can you let us know if there's something really nasty going around? Because we may keep her out for a couple of days. And just work with us on that. And the teacher was shocked because she did get to know B first. And so she was like, wow, she looks like such a healthy kid. And I was like, she is, that's the thing. She is a healthy kid. So, but all these extra things just will help keep her that way.
My advice to anybody that's going to have children starting daycare or kindergarten is just educate yourself as much as possible. Get the education from the CF clinic. Ask as many questions as you possibly can. The more you know, the better it's going to be.
When you're getting ready to put your CF kid into daycare, I think you have to not worry about it. You have a lot of anxiety anyway, putting young children into daycare, childcare, preschool, especially if you're looking at a large daycare center. I think if you make CF an extra worry on top of the normal developmental health worries that you have, you're going to stress yourself out way too much. When William was born, someone at the CF center gave me some really great advice, and that's really carried me through, and it was just treat William like a normal kid.
To learn more about this issue, ask your CF Foundation accredited care center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.